Hello everyone. In this section, I will talk about diagnostic and research techniques in pathology. The diagnostic and research techniques in pathology can be divided into two categories: the human pathology and experimental pathology. In human pathology, autopsy is carried out usually at the request of clinician to verify the cause of death, to see whether correct diagnosis was made and whether appropriate treatment was given. Sometimes it was at coroner's request during the investigation of criminal cases and civil cases. The second part is surgical or diagnostic pathology. Biopsy can be performed using a needle to extract a small piece of tissue, or done by resection in surgery, or during the endoscopic examination. Cytopathology is to diagnose from individual cell or fine needle aspiration biopsy. It is used as rapid screening test to determine whether something is malignant or not. There are two major techniques to collect the material, including scratching, like the cervical cytology test. Another one is fine needle aspiration biopsy, for example, the thyroid biopsy. Sometimes we collect cells from liquid in body cavity or urine by centrifugal precipitation. Then the paraffin-embedded cell block was made. Another category is experimental pathology. We design animal models to mimic human disease and investigate the etiology, pathogenesis, and symptoms of the disease. But the data cannot be directly applied to human beings. They should be carefully evaluated. Here are two groups of nude mice models with tumors in their armpits. Another method of experimental pathology is tissue and cell culture. That means we replicate the conditions in vivo in order to keep the cell and tissue alive and proliferating in vitro. This picture shows us how cell culture is performing. We do it in the clean bench and wear sterile clothing like this. This is the cell culture dish with pink culture media in it. The fourth picture shows live cells in dish. Next, let's talk about the basic techniques used in the diagnosis. Firstly, the gross observation. Gross observation is the first and critical step of handling a specimen. The lesion's size, color, shape, consistency, and its anatomic relationship with the adjacent normal tissue should be described and recorded. As for the whole organ, the weight, edge, surface, and cut surface should be described. The picture on the right side is splenic infarction. Here is the lesion. We should describe its characteristics following the directions. For example, The lesion locates close to the capsule. It's triangle with light yellow color and clear border. The histologic observation is the most common method to diagnose the disease. The tissue was formalin fixed, paraffin embedded, then cut into slices and HE stained. The observation of tissue section. I believe you have already learned it in the class of histology, so I will skip this part. IHC is an important and useful technique in diagnosis. It is based on antigen-antibody reaction to identify specific protein in section. Its main application is to perform a location analysis. For example, in epithelial membrane, cytokeratin will be positive stained. IHC is also used in clinical diagnosis. It can help to distinguish tumor histogenesis. Here is a case show us how the IHC is used in clinical diagnosis. A patient went to see a doctor because he found an enlarged mass on his neck. The doctor thought it might be a lymphatic node. Then the mass was cut out and sent to a pathologist to find out the answer. The HE stained section of this mass showed it was a lymph node, but some additional glands were found in it. They are here. We all know there should not be any gland structure in normal lymph node, so that must be a metastasis of malignant tumor. Then there comes another question. Where do the malignant cells come from? It could have been from stomach, colon, even lung. So the pathologist decided to use IHC technique. The tests showed CK and PSA were both positive in gland cells. CK positive means it was epithelium-derived tumor. PSA is prostatic-specific antigen in prostatic cancer. Therefore, we got the answer. It is prostatic cancer metastasized to lymph node on the neck. The ultrastructural observation, we do it by electron microscope. The SEM means scanning electron microscope. It is used to observe the surface morphology of cell. Just like this. The TEM means transmitting electron microscope. It is used to observe internal structure of cell. Some molecular biology techniques are applied in pathology, such as PCR, DNA sequencing, biochip technique. The biochip technique includes gene chip, protein microarray, tissue microarray. This is tissue microarray. Many samples from different patients were arranged in lines in one paraffin-embedded block. This technique is widely used because of its high throughput and standardization. Now, let's talk about the history and evolution of pathology. In 1760s, Mogany is the most famous early growth pathology. His writing described the findings of over 600 partial and complete autopsies. In 1850s, Rudolf Virchow is generally recognized to be the father of microscopic pathology. He founded cellular pathology. Julius Cohenheim is one of the earliest experimental pathology. He combined histology technique with experimental manipulations to study inflammation. Also, he pioneered the use of frozen section procedure. In 1960s, the electron microscope was invented. Then, many subspecialties were founded. The ultrastructural pathology, immunopathology, molecular pathology, genetic pathology, and quantitative pathology. From the history of pathology, we found a rule that the development of pathology is closely related to the development of microscopy, right? Okay, now let's take a summary. Pathology is the study of etiology and pathogenesis of disease. What do the pathologists do? Diagnose and characterize the diseases. They also conduct autopsy to verify the cause of death and study the mechanism of the diseases. How to study pathology? We need to focus on the morphologic change of disease and link the other three aspects to morphologic changes, including etiology, pathogenesis, and clinical significance, as to better understand a disease. In the end, I'd like to finish this part with a motto from William Osler. He said, "As is our pathology, so is our medicine. 病理学为医学之本." And I hope you all enjoy studying pathology in the following classes. Thank you for listening.